Welcome top news today.
Healthcare experts say President Donald Trump's executive order amounts to Affordable Care Act sabotage, but certain states will feel it the most. Mandel NganAFPGetty Images Are we still talking about Obamacare? Somehow, over 7 years since the Affordable Care Act became law, Americans still have to worry about it, discuss it, and scream at members of Congress about it. No matter how popular it has become, hardly a week goes by without lawmakers trying to repeal it. After another repeal effort failed in September 2017, President Donald Trump took matters into his own hands. In the second week of October, Trump signed an executive order to end subsidies to people with the Affordable Care Act who have the hardest time affording deductibles and copays. According to figures from the Centers for Medicare and Medicaid Services, nearly 6 million low-income Americans depend on these subsidies. Once the government stops making payments, insurance companies either will have to raise premiums by huge amounts or abandon the market. Already regulators approved rate increases of over 40% in some states. If insurance companies decide to leave, hundreds of thousands will lose coverage. So welcome to Trumpcare. If you live in a state with a high number of people benefiting from subsidies, healthcare costs will soar, pushing prices beyond reach. Here are the 15 states that will be hit hardest by Trump's executive order on healthcare. 15. Hawaii. On the Hawaiian Islands, the number of Affordable Care Act enrollees receiving subsidies 9,859 might not be high, but the percentage is quite significant. Centers for Medicare and Medicaid Services statistics show 59% of those with the Affordable Care Act benefit from the cost-sharing reductions. Hawaii is one of the few states on this list that did not vote for Trump in the 2016 election. Next, the state's lone House representative stands with Trump in ending subsidies. 15. South Dakota. U.S. Rep. Kristi Noem, far left, R. South Dakota, supported Trump's executive order ending subsidy payments. obamacare Images in South Dakota, where Trump received over 60% of the vote in the 2016 election, about 6 in 10 Affordable Care Act enrollees will see subsidy payments end. Stats from the Centers for Medicare and Medicaid Services show 16,144 people receiving these subsidies in 2017. As a percentage of those on Affordable Care Act plans, 59% will be affected. But Kristi Noem, the state's lone House representative, said she supported Trump's executive order. What that will mean for the rest of South Dakota should worry anyone with private insurance. While Sanford Health will remain in the state for the time being, a Sanford spokeswoman told the Associated Press rates would rise more than the company expected a few weeks ago. Next, more than 100,000 people in this southern state will see subsidies end. 13 Tennessee. Thousands, such as this little girl, receive free medical treatment from volunteers in Tennessee because of a lack of insurance. Mario Tomaggetti Images. The percentage of Tennessee residents who voted for Trump, 61%, is quite close to the number of Affordable Care Act enrollees who will see subsidy payments, and 59% as a result of the executive order. All told, some 118,901 people in the volunteer state will be affected. Prior to the Trump order, Cigna had approval for 36% rate increases in Tennessee, while Blue Cross quoted 21% increases. Those numbers will rise again without a change in policy. Next, over 200,000 residents here will kiss subsidies goodbye.